And we get those questions right here to my cell phone so I can ask the doctor for you. Joining us today through 6 o'clock is Cone Health's COVID-19 lead physician, Dr. Brent McQuaid. A lot of people want to know, President Joe Biden got his booster shot earlier today. Am I eligible to get mine?
Yeah, that's a very good question. As we all know, this has been a hot topic over the last several weeks. When can we get boosters? Who can get a booster? And so what I have for you is fresh off the CDC's website. So it's important to know that you're eligible for a booster if you've had Pfizer. People who are eligible for boosters are folks that are older than age 65, adults who are 18 or older who live in long-term care settings, or people who are age 50 to 64 with underlying medical conditions. Other people who may also be considered eligible are those folks who live or work in a high-risk setting. So those right now, that's what the CDC is telling us are the indications for getting a booster.
Some people want to know, I had Moderna. Can I get the Pfizer booster?
My recommendation would be no at this time. I don't think that would be advisable, considering that's what the FDA has given us specific guidance on that. Hopefully we'll learn more from them over the next several weeks.
Is the booster shot the same one as the first two doses? Is it the same strength?
Essentially the same. Yep. So basically it just has your body create a protein that your immune system then reacts to again to kind of just get your immune system charged again and ready to fight off COVID.
And does that mean that you're going to have the same side effects as last time around?
I think it's safe to expect that you'll have similar side effects. And I've heard that from others as well who've already had their booster.
Someone wants to know, if I had a bad reaction to the first dose, can you pass on the second dose and just say that you got vaccinated?
No, that wouldn't be advisable. I would have that individual speak with their physician about what the bad reaction was. Certainly if we're talking something life-threatening like anaphylaxis, then, the physician and the patient will have a hard conversation about what the most appropriate next steps are. However, what's considered a bad reaction may actually not be life-threatening, whereas we know that COVID is. And so that would be worth having a conversation with your physician about.
Okay, lots of people want to know about the booster shot and other vaccines at the same time. Can you get shingles and the booster shot at the same time?
My understanding is that it's safe to receive multiple vaccinations with the booster shot at the same time. So my answer is yes.
That also goes for the flu shot, correct?
That's correct, yep.
Someone else wants to know, where can I get the booster if I'm eligible?
So starting tomorrow at Cone Health, you'll be able to register through our website. I think that local pharmacies, CVS, Walgreens, our commercial partners who've done an outstanding job of helping us get vaccinations will be part of that as well. And then I'm sure there'll be resources available through the Guilford County Department of Health as well.
And lots of people still texting in who's eligible. Do you mind reading that one more time from the CDC?
Yeah, absolutely.
I think that's really important to make clear here.
Yes, and again, so I'm reading this right from the CDC's site, so this is easily accessible to anyone with an internet connection. But again, so you're eligible for a booster if you've had Pfizer, you are older than 65 years old, you are an adult who's 18 years old or older living in a long-term care setting, you're age 50 to 64 with underlying medical conditions, such as someone who's immunocompromised or maybe multiple problems like high blood pressure, kidney disease, diabetes. And then again, those people who are adults age 18 to 64 who are at risk of COVID-19 exposure due to their work setting, so perhaps working in a high-risk setting like healthcare.
What is the danger of getting the booster before the time that you're supposed to?
That's a good question. I would say that if you've already been fully vaccinated, so if you've already had the second vaccine, that the risk of a severe reaction with the third one would be relatively low. You may have a bit more intense of a side effect, local redness or swelling or feeling bad if you got it earlier than you should have. But that's speculation. What I would recommend is that people just follow the recommendation and get the booster when it's recommended.
How long do you have to wait after having COVID before you can get the booster?
After having COVID? That is a very good question. I will look up the answer to that one. I know the answer to how long after you get a monoclonal antibody. If you've received a monoclonal antibody, it's 90 days. But let me look that one up and I'll get back with you on that one.
Okay, well, we're going to give you some time to check into that during this commercial break. If you have more questions, please text them in 379-5775. We'll be right back.